At a press conference on COVID-19 led by opposition leader Honorable Patrick Faber, former CEO in the Ministry of Health Dr. George Gough spoke about the management of essential resources to fight the pandemic.
The physical and the human resource. Even the physical resources are only the existing resources that the last administration left behind because of financial reasons that are quite obvious to every Belizean citizen. And obviously the human resource, which is also limited. But I think in one of a blanket statement that we will be putting out today in a press release is basically we want to say that we have observed in this third wave that there's been recent closures of our different health institutions. And we have seen that he has left out the elderly, the chronics, and the public at large without access to the normal health care that they should be receiving. And keep in mind, there's only about 15%, I would want to dare say now 10%, that can afford access to health care in the private sector. We still need to look after the 90%. And these people are no longer being able to access our public institutions because COVID has taken priority. This has led to the surge, as you all know, and observing the numbers that are put out every day by the government, you can see the clear reality where the chronics and the elderly are ultimately paying the price. We feel that the physical resources and the human resources could be handled in a much better way.
Dr. Gough questioned the ill-advised over-centralization in the treatment of COVID-19 patients.
When we have these institutions and we have these institutions that have been equipped, and I say this from the last administration, that are not utilized because policies and procedures are not put in place, and then the burden of all these patients are put on our only tertiary institution. That is unfair because the 2 or 3 regional hospitals were equipped not to handle an ICU patient, but were equipped to handle patients with COVID. And when you look at the numbers that are put out every day, you see about 40-50 patients with COVID, not in the ICU ward, which I am sure maybe half of them have come from the districts. That again centralizes the use of the resource, that creates inefficiency, and then the health system itself goes into a quicker collapse.
He spoke about this government's lack of priorities in securing what's needed for the most vulnerable and less privileged persons who contract COVID-19 to receive proper treatment.
Because they are finding monies to buy other things that are not in healthcare, and yet the key life-saving medications that they should be buying for the public that are become ill, they are not buying, and thus these patients have not been given a fighting chance. And I call this out because I think the Ministry of Health should be procuring these life-saving medications, obviously not through middle people but directly from the source, which would then be more sustainable and affordable to be given to the populace that requires it.
Dr. Gough concluded by calling on the political directorate to heed the advice of the professionals on the ground in order to successfully fight COVID-19.
The people that are in charge are very knowledgeable, they know what they need to do, and I am hoping that the powers that be will listen to them. I'm sure they're giving the best technical advice. I'm not sure if the people that are deciding are receiving the advice, because I've seen my colleagues from the college, hospital, out here on the media, I've seen my colleagues in the private sector on the media, and they're saying all the right things, yet the right things are not being done. So I am calling it out. Please listen to the professionals. Please listen to the physicians that are on the ground. Please listen to somebody that's on the ward. I can only have respect for Dr. Gonzalez. He's in the ward. He's on the ground. Listen to people that are on the ground.